When does ovulation bleeding occur in the menstrual cycle?
Ovulation bleeding, also known as mid-cycle bleeding, is a phenomenon where a small amount of spotting occurs during the menstrual cycle. In this video, we'll explore what ovulation bleeding is, its causes, and when it occurs in the menstrual cycle.
What is ovulation bleeding?
Ovulation bleeding is a minor spotting that occurs during the menstrual cycle. It is different from menstrual bleeding as it occurs mid-cycle and only lasts for a short period. Ovulation bleeding can be caused by several factors, including hormonal fluctuations, changes in the cervix, or the rupture of a small blood vessel during ovulation.
What causes ovulation bleeding?
Ovulation bleeding is mainly caused by hormonal fluctuations. During ovulation, the level of estrogen in the body rises, which stimulates the release of luteinizing hormone, LH, and follicle-stimulating hormone, FSH. These hormones cause the follicle in the ovary to rupture, releasing an egg. As the follicle ruptures, a small amount of blood is released, which can cause ovulation bleeding. Other factors that can cause ovulation bleeding include changes in the cervix, such as increased blood flow or changes in mucus production.
When does ovulation bleeding occur in the menstrual cycle?
Ovulation bleeding usually occurs around the middle of the menstrual cycle, between days 11 and 21. However, this can vary from person to person, depending on the length of their menstrual cycle. Ovulation bleeding can also occur due to certain medical conditions, such as endometriosis, polyps, or fibroids. If you experience heavy bleeding, severe pain, or any other unusual symptoms during ovulation bleeding, it is important to consult your doctor. Ovulation bleeding is a common and usually harmless occurrence during the menstrual cycle. It is caused by hormonal fluctuations and occurs mid-cycle. Ovulation bleeding usually lasts for a short period and can vary from person to person. If you experience any unusual symptoms or heavy bleeding, it is important to consult your doctor.